data.
Clearly, the projections are pretty grim.
Ontario could see over 18,000 new COVID-19 cases per day by the end of May. That's according to the latest modeling set to be released tomorrow. We'll break it down. Plus,
unfortunately, our situation is dire.
To slow the surge, tougher measures could once again be on the way. We'll have the very latest. And a Toronto-based home builder and one of its contractors under scrutiny tonight after photos surfaced on social media showing workers partying with a stripper at a job site. Good evening, I'm Kelda Yoon. Well, tougher restrictions could be on the way once again. Doug Ford's cabinet met tonight to discuss the possibilities as COVID-19 case counts continue to surge. Our Greg Ross is standing by live for us tonight. And Greg, we do know one measure is now off the table.
That's right. After a long night of debate for Doug Ford and his cabinet, they were able to come to terms on at least one issue, and that means that they will not be imposing any kind of lockdown in Ontario, similar to like we've seen in Quebec. So no lockdown, but there were a number of other options that they had to weigh in on as they look to get this virus under control. Now, we've got some of those things that they were looking at tonight. None of this has been formally approved yet, but they include closing all non-essential retail, including no curbside pickup or delivery, and they'll be further restricting hours of operations for those businesses. Also on the table, shutting down non-essential construction, warehousing, and manufacturing not related to health, food, or the automotive sector. They're also looking to prohibit all outdoor gatherings for non-family members in the same household, tightening the capacity limits of indoor religious events and funerals, and increasing fines for non-compliance of these lockdown rules, and increasing police powers also to enforce those rules. The province was left with no other alternative but to take these drastic measures because, of course, the strain that this virus is having on our healthcare system.
Ross, yes. Okay. The numbers are staggering. Without drastic measures, we're on pace for as many as 18,000 new cases a day in Ontario and potentially 1,800 people being admitted to the ICU. The numbers seem even more terrifying when you consider our healthcare system is already operating over capacity.
It's not about to be stretched beyond capacity, it is stretched beyond capacity. We're at a point now where surgeries are being canceled in most of the province to make room for this huge influx of patients with COVID-19. Like never before have adults been admitted to pediatric intensive care units for lack of space. Like it's pretty serious.
Infectious disease specialist Dr. Isaac Bogosh says there are some key reasons why we are seeing numbers spiraling out of control, including opening things back up too soon after the second wave and not giving ICUs a chance to decompress. He says we're also seeing the effects of the newer variants of the virus.
We certainly have variants of concern. You can't ignore that. They cause wider outbreaks and larger outbreaks, and they also cause more significant illness, so proportionally more people will land in hospital.
The province has formally requested help from the federal government, asking for 600 additional healthcare workers to be brought in to help.
This is not, any everyday healthcare provider. This is a very specialized area of healthcare. This is critical care. This is, doctors and nurses and respiratory therapists and physiotherapists and occupational therapists and on and on and on that are trained and dedicated their training to be specialized in intensive care, patient level of care.
Obviously, there is a sense of urgency tonight with these case counts on the rise, and that is why Cabinet is going to resume meeting tomorrow as they will continue to discuss imposing further measures for the province to try and get this virus under control and alleviate the pressure right now on our healthcare system, Kelda.
Yeah, absolutely. And we do know tonight that at least there will be no curfew that will be coming. Thanks so much, Greg. That's Greg Ross reporting live for us tonight. Unity Health is halting vaccinations at 2 Toronto hospitals due to a vaccine shortage. They say their clinics at St. Michael's and St. Joseph's hospitals will be closed as of April 18th and won't reopen until at least April 26th. Unity Health says vaccination appointments already booked at St. Mike's and St. Joe's will not be canceled, but may be changed to accommodate new clinic hours. The network says this is being done to focus available resources on high-risk groups identified by the province. And Ontario is reporting more than 4,700 COVID-19 cases today, a new record high. Hospitalizations and ICU numbers in the province have been climbing for a few weeks now. The number of deaths has remained steady and low compared to previous waves of COVID-19, but we have seen an increase over the last 2 days. Angelina King has more on what hospitals are bracing for.
We're doing CPR right now.
An urgent call from an ICU doctor.
Anything people can do to try and help prevent the spread will potentially help the healthcare system avoid what looks to be a potential significant catastrophe moving forward.
In the last week, the number of people in hospital with COVID-19 in Ontario has climbed steadily to more than 1,900 patients today. And each day, more people have been admitted to ICUs. Today, there are 659. Reported deaths have fluctuated in the last week, but there's been an increase in the last 2 days. As of this morning, 29 more people died, a third wave high, bringing that total to 7,639 lives lost.
The cases we're seeing now are mainly cases that were transmitted over Easter weekend.
Biostatistician Ryan Imgrund tracks COVID-19 data and says while case and hospitalization numbers are the highest they've been, he's optimistic deaths won't be the same, thanks to long-term care residents and the older population getting vaccinated.
What I'm seeing over this next month or so is that we're going to be averaging between 20 to 25 mortalities per day, versus back in the second wave when we were seeing around 45 mortalities per day.
But with variants taking over, doctors say patients are getting younger.
The challenge is that you're seeing younger patients with no previous history, medical history, or comorbidities getting very, very sick.
Dr. Detsky says it's too early to say what the survival rate looks like for young people in critical care who are infected with a variant, but says measuring deaths shouldn't be the sole focus. He says for those who survive serious cases, their lives could be changed forever.
This isn't just about living or dying, that there's going to be a lot of morbidity that people experience. They may not go back to their employment. They might need to be cared for by family members or, hire private caregivers.
While those stories slowly emerge, hospital staff continue to hang on and help.
It's also dealing with the strain on you emotionally as you do your best to support the patients that are having themselves the fight of their life.
Angelina King, CBC News, Toronto.
Toronto-based home builder Mattamy Homes is speaking out tonight after an incident involving a stripper at one of its job sites in Milton. Now, these photos were posted on social media today. They appear to show a stripper at a party hosted at a Mattamy Homes site, attended by workers of its trade partner, Nelmar Drywall. No one was wearing masks in any of the photos. Now, CBC News was also sent a video, but it was too graphic to show on air. In a statement to CBC News, Mattamy Homes confirmed that an incident did take place on April 9th at one of their homes under construction, involving one employee and other subcontractors of Nelmar Drywall. It said it has terminated their relationship with everyone involved, adding, "We hold our trade partners to a high standard and insist that they conduct themselves professionally and ethically. Those standards were not met in this case, and the individuals in question behaved in a grossly inappropriate and reckless fashion. We will be reinforcing with all our trade partners our zero tolerance policies and clear expectations regarding workplace code of conduct, as well as our strict COVID-19 protocols." Now, Nelmar Drywall also responded, stating Nelmar wholeheartedly denounces the conduct displayed. Upon being made aware of the incident, Nelmar took immediate steps to investigate the matter to determine the identity of all those individuals involved and has terminated the employment of all persons involved in the incident. The province announced today health and safety inspectors will be visiting the province's 1,300 construction job sites. Now, some 200 plus inspectors will be looking at physical distancing, ensuring employee screening is being done at the start of every shift, and whether PPE protocols are being followed. Inspectors will also be visiting big box retailers, warehouses, and food processing plants this weekend in Toronto, Ottawa, and York Region. Meteorologist Colette Kennedy joins us now with a first look at the forecast. And Colette, a cloudy affair today with some of that rain sticking around.
Yeah, that's right. Really soggy. And I mean, not constant, but it is the kind of thing where we're going to continue to have some scattered showers in the forecast, not just tonight, but this goes into tomorrow, even tomorrow evening as well. So it's just as these bands of rain rotate around our area of low pressure, even though it's going to be starting to move off to the east. Not only that, notice anything here? Yeah, with some colder air, we did have and continue to have some areas with some spotty light snow or flurry activity in there, closer to the shores of Lake Ontario and Lake Erie. This is primarily just rain shower activity that we're looking at. But here we are into Friday, even into the afternoon. So cloud cover, even when we don't have the showers, is really hanging in there. Then as we're headed into Saturday, we are going to see some changes. So I'm going to go into more detail on the weekend. That's coming up. Tonight, here are the temperatures to go along with the soggy conditions. 4 degrees, and Kelda, the high tomorrow, 9.
Thanks so much, Colette. A pedestrian was killed this afternoon after they were struck by a dump truck in North York. It happened near Finch Avenue and Sentinel Road at around 3:30 in a construction area. Police say the driver of the truck remained on scene. Anyone with information or dash cam video is asked to call police. When COVID-19 ravaged long-term care homes, hospitals stepped in to help. Now, with hospitals on the brink of being overrun with patients, the favor could soon be returned.
We're in a crisis today. We have a duty and an obligation to work together as a system to help our hospitals who came and helped us.
Details on the proposal that could see thousands of people right now in hospital moved into vacant beds in long-term care homes, and why some are saying it's a horrible idea. Next. Welcome back. Every single person in the Grey Bruce area should consider themselves a COVID-19 carrier. That's the dire warning from health officials there after cases tripled in recent days. Grey Bruce covers the towns of Owen Sound, Blue Mountains, Meaford, and the South Bruce Peninsula. 73 new cases were logged in just the last 36 hours. The region's medical officer of health says she expects those cases to potentially have hundreds of close contacts. For the next 2 days, everyone in the region is asked to stay home so officials can contact trace. The jump in cases in Grey Bruce is being blamed on people not following the stay-at-home order and social gatherings and parties held by high school students. How about this idea? Move thousands of patients from Ontario hospitals into long-term care homes. It may sound shocking, but it's already started in an effort to ease overcrowding. Lorena Redekop has more.
It's homes that experience the worst outbreaks and the most deaths that now have the most space, according to Ontario's Long-Term Care Association. It says 6,000 beds in the province are sitting empty. Now, long-term care is seen as a solution.
We're in a crisis today. We have a duty and an obligation to work together as a system to help our hospitals who came and helped us.
We obtained part of a document sent to the long-term care sector from the province, calling on each home to accept 2 to 3 residents at a minimum. In a statement, the Ministry of Long-Term Care says the government issued a call to action to homes on Sunday to do everything they can over the next 2 weeks to safely admit or readmit hospitalized patients waiting for a space in a long-term care home. The ministry says its goal is 1,500 transfers over 2 weeks, none into ward rooms, those rooms with 3 or 4 beds, and the association says all have to be vaccinated.
They're not going to be COVID patients. These are genuine, what they call alternate level of care patients. So these are people who have been ready in hospital for discharge out of hospital, and they no longer require acute care.
Putting more people into a broken system isn't a solution.
The opposition couldn't believe it.
I was shocked and horrified. If it comes to that, then let's hope that the government has a plan to resource these facilities and provide the staffing levels and the supports that people need.
Our healthcare system is in crisis, and we need to make space.
Geriatrician Dr. Nathan Stahl says this can only happen in homes with appropriate staffing levels, something the ministry says will happen.
It seems unbelievable. One of the safest places to be during this third wave is actually in a long-term care home right now. We're seeing really low numbers of cases. Outbreaks do not seem to be large. We have really been able to stop the virus in its tracks.
He also wonders whether hotel rooms or field hospital type structures could be used to add extra long-term care space during this third wave. Lorena Redekop, CBC News, Toronto.
We have a goal for Toronto.
The Leafs taking on the Winnipeg Jets tonight. The first goal of the game almost went unnoticed, bouncing in and out of the net. The Jets would score 3 goals in the first, and the Leafs came within 1 in the second with a goal from John Tavares. But the Jets scored 2 more in the third to take this one 5-2. The Leafs were without Austin Matthews tonight. He's out with an injury and listed as day-to-day.
First pitch swinging, and he crushes it.
And the Jays taking on the Kansas City Royals on Jackie Robinson Day. Let's jump ahead to the top of the 7th. Vladimir Guerrero Jr. getting the team within 2 runs with this solo homer. But that's as close as they would get. The Royals win this one 7-5. Cloudy tonight, and we've been seeing that light rain come down through the evening. This will continue into the overnight, currently 6 degrees downtown. Let's go back to Colette now with a look at the extended forecast, and scattered showers again tonight. Colette, seems to be the theme this week.
Yeah, that's right. You got to have your umbrella around. Be prepared for this again for Friday. And then we have a slight chance on the weekend of getting some showers, but it's diminished greatly. So they're hanging about for now. As we look at the weekend, they'll be increasing cloudiness on Saturday, but still we'll start off with some sunshine in there. And here's another thing. The temperatures will be rebounding from where they are now, which is a little below seasonal, and we're going to see them pop just a few degrees above seasonal as we look at the highs for Saturday and Sunday. So daytime highs today, yeah, you have to look hard to find double digits. Ottawa, the nation's capital, doing it there at 11 degrees. Otherwise, those temperatures were stubborn, having trouble warming up as this area of low pressure above us or affecting us is also stubborn. So we get the rotation of the rain showers coming through, then a break, but not necessarily a break of the clouds, and then we see more coming through and into the higher terrain, even some wet flurry activity. There's even a chance for that through Sarnia over towards London too, as we look ahead into Friday. By Friday night, we'll start to break away from this, so the clouds will start to break up, setting us up for some sun to start things off Saturday, and then as we go through the day Saturday, yeah, clouds will be increasing, and just look at, I mean, isolated showers, such a slim chance there. Again, into Sunday, we'll kind of have variable skies with a slight chance for some wet weather. Tonight, though, these are your temperatures. Southwestern Ontario, just above the freezing mark, and that's why that little bit of a mix possible, but it's actually going to be breaking out into a nice day, probably up to 13 degrees actually into Windsor, Leamington as well, and then you see still some single digits there even for your daytime highs into London and Sarnia. Tonight, Toronto, 4 degrees, that low. St. Catharines, slightly cooler at 3. And then tomorrow afternoon, here you are, Oshawa, you might get to that 10 degrees, kind of a flip-flop of what we often see when we get the breeze coming off the lake, because we're going to have a northwesterly flow, may even get that temperature to 10 degrees. Saturday, here you are with that little bit of a warm-up, so 12 for the high. Overnight lows remain mild. Sunday, 13, Monday, 14. I do want you to take note that a blast of cooler air is going to be coming mid-week next week, but We'll leave that till then, Kelda.
Let's do that. Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
Ever since we were little, we never saw ourselves represented in literature. This book is really just being there for kids in a way that we didn't have growing up.
Upon seeing the rise in anti-Asian racism during the pandemic, 2 Toronto sisters decided to each publish a book, sharing their experiences as first-generation Chinese Canadians in hopes of empowering other East Asian youth. My conversation with them after the break. Two Toronto sisters are hoping their words will help uplift other East Asian youth at a time when their community is being heavily stigmatized. Sarah and Selena Guo are 17-year-old twins who each wrote, designed, and published their own book during the pandemic in response to the rise in anti-Asian racism. I spoke to them about what they hope to express through their books and the importance of representation.
Since we grew up in primarily Caucasian neighborhoods, we were very aware of our differences.
Growing up in Toronto as first-generation Chinese Canadians, twin sisters Sarah and Selena Guo have always straddled the line between two cultures, at times feeling isolated and disconnected. Their community, though, had always been welcoming, so they were taken aback when they first heard of the sharp rise in anti-Asian racism during the pandemic.
Since we never really experienced it too much, we actually didn't realize how much and how prevalent it was. It sort of escalated to a point that we were fearful that we were teaching our parents words to defend themselves.
That's when they got the idea to each publish a book. Sarah's book, entitled One Point in Time, is a collection of free verse poetry inspired by her personal experiences.
Bunch by bunch, you take them out and place it on a china plate. You were told that's the way to eat dumplings.
Besides helping East Asian youth connect with their cultural roots, she hopes her writing will make them feel less alone.
You remember you have school tomorrow. You can't bring your dumplings to school. Your dumplings have Chinese chives, and they smell bad. So I wanted to focus on a variety of topics. So I wanted to not only embrace East Asian cultures, but I also wanted to highlight, again, some stereotypes such as the model minority myth. They don't see the endless nights of page flipping or the repetitive motion of sliding your yellow highlighter across the page. Whenever we do succeed, for example, getting the top of the class on a math test, we feel that sort of downplayness of our hard work when people just say, because you're Asian, you're smart, or because you're Asian, you're good at math.
Selena's book aims to debunk stereotypes as well. She also hopes it will empower others like herself.
My book is called East Asian Girls Can. Sort of one sentence of an inspirational line and then a fact section. Because this book is graphically designed for a lot of young youth as well, I wanted to provide them some non-fictional facts to back up my points.
In it, she also touches on the negative impact of certain cultural norms she experienced growing up.
This is mostly just, there's always at family gatherings, people want to show off the kids, and sometimes kids, when their parents don't brag about them or they don't do anything too, significant. It's supposed to just empower them that it's okay if that happens and they don't have to be the perfect or golden child.
The sisters hope to inspire other young people in the East Asian community to share their stories. They also hope to see more schools incorporate diverse books in their curriculum.
Ever since we were little, we never saw ourselves represented in literature. This book is really just being there for kids in a way that we didn't have growing up. I think diversifying literature is so important because it gives youth a sense of belonging, so they can see characters that act and even think the same way as them. And books have the power to encourage readers while at the same time enlighten other readers on the truth about the lives that they don't live.
And both their books are available for purchase on Amazon. That's our show for you tonight. Thank you so much for watching. Remember, you can get caught up on our website anytime. Head to cbc.ca/Toronto. Dwight Drummond has your next local newscast tomorrow at 6, and I will see you back here tomorrow night at 11. Have a great night, everyone.